of a movement that is mainly focused on addressing the needs of the young women and adolescent girls in communities. And through our engagements with these young people through the Web for Life network, we have come to realize a number of challenges that are being met in terms of them accessing their in terms of them accessing the services and commodities that they need. And also, aside from the Web for Life network, we also have a toll-free line, because through engaging with the young people, we then realize that most or some of them are not very comfortable openly discussing some of their sexual and reproductive health concerns face-to-face, either with their caregivers or with any person who may be knowledgeable about certain issues that they may need assistance with. So through our toll-free line, they can be able then to reach out to us, get this information that they need, where necessary, get the referral for services that they need. So some of the issues that have been raised by young people, the first one that we have noticed is that there is a serious knowledge gap. Yes, some of us seated in this room may argue to say that a lot of organizations are going in communities, empowering young women and adolescent girls with adequate information on sexual reproductive health. But the honest truth is that there are certain platforms, or if I may say, at times, when we disseminate information, there's some sort of restriction that is there to the information that is disseminated to young people. I can give an example to say, yes, someone might argue, yes, there's the curriculum, the education curriculum also includes SRHR issues that can help young people to better navigate their lives. Yes, they are discussing about it, but the honest truth is they do not have the adequate information, because at times some of the information that is being given to them is censored. So that also contributes to some of the challenges that they later face, such as unplanned pregnancies. So, and then the lack of knowledge as well, I can say that it is also an indication of a broken system and culture. Why am I saying so? It's because, yes, we have come to the age of modernization, where we say young people can access information easily through the internet. But the honest truth is, the information that they are accessing, is it the right information or is it the wrong information? And as we all know, information is better coming from someone who is closer to you, where you can confirm if the facts are correct or the facts are wrong. So because of our cultural system, it becomes then difficult for most young people to openly discuss about such issues, because they fear being labeled as young people that have loose morals. They come from a home where they are not well cultured. So those are some of the issues that young people are facing. And further to this, there's also the challenge of inability to access some of the services that they need. Inability to access in the sense that some of the services that they may need may not be accessible, because adolescents, most of them, are below the age of 18, which means that they are below the age of sexual consent. And like the first speaker rightfully said, because they are deemed to be people who cannot consent to sex, then most people assume that automatically they do not also have a need for SRH clinical services, such as contraception, to mention but a few. So some of them are not very open to visiting clinical facilities to say, I think maybe I may need this SRH service or so. So this has also contributed to the increase in teen pregnancies, because they do not, they fear seeking for these services. And then also, it also comes to the issue of cost. When it comes to cost of services, I'm speaking mainly also adolescents and also young women, to say some of the services that they require. Yes, we have partners that are offering some of the services for free to the young people, but there are certain services then that they may need to pay for, and those services they cannot afford. And yes, Say What and other organizations have also been providing vouchers that young women can access the services that they need, so as to prevent the unplanned pregnancies and also ending up resorting to maybe unsafe abortions because they could not freely go to access a service. I can say that the resources that are available from CSOs is not adequate to meet the demand for the services from the young people. So those are some of the major challenges that the young people are facing in accessing SRH services. And these have also, in a way, contributed towards the increase in teen pregnancies and also the increase in early child marriages, because once a young person gets pregnant, culturally the parent can then say, you are pregnant, then you should go and live with the father of the child, which is not really what we would want for the young people. So we propose that as we discuss, may we also look into maybe a redress to the education of young people on issues to do with sexual reproductive health and rights, make the environment more permissive for open and free discussions, whether be it at school, be it in the community, so that young people can be free to ask questions, and also this will also help them make informed decisions. And then we also propose that where possible, services be accessible and affordable for young people, because most of them cannot afford because they are adolescents, or young women may also not have means of paying for services. And then the last one would be say what we believe that we should work with young people, for young people, and by young people. So which means that we should be able to make sure that as we are working with young people towards realizing their full SRHR rights, that they are able to realize that they are empowered, capable, and they are the future of tomorrow. Thank you.
Thank you very much. Say what? May we move on to Women's Action Group?
Thank you, Tari.
And may I request that we try and condense our contributions? Thank you.
Okay, for me, it's really sad that we are sitting here this morning talking about adolescents and maternal health. That shouldn't be our topic, really. We should be talking about adolescents and how they can achieve in life in different spheres, not in childbirth. I just want to define maternal health, because I've been asked to speak about maternal health. It refers to the health of women during pregnancy, childbirth, and the postnatal period. So we are here talking about pregnancy of young people. And it is expected that at every stage, it should be a positive experience. But for young people, this is not a positive experience. We also need to recognize that every pregnancy and birth is unique. And for young people, there are so many complications that come with pregnancy. We also note that health outcomes are affected by the inequalities that exist in society, the gap between the rich and the poor. And we are saying as a country, we are pushing towards SDG 3, which says we must have 70. We must reduce maternal mortality ratio to 70 per 100,000 live births. But for Zimbabwe, we are currently at 362 deaths per 100,000 live births. So I'm wondering if we'll get to 70 by 2030. All these are issues for us to look at. When we look at the situation in Zimbabwe, the National Development Strategy 1, 2021 to 2025 already highlights the gaps within the health delivery system. They highlight that health sector is faced with critical shortage of specialized professionals and healthcare staff. And for adolescent pregnancies, we need this staff. Demotivated staff, imagine how then they will look after a pregnant adolescent if the one is demotivated. It also acknowledges that our hospitals are dilapidated. This is from the government publication. So what we see is there are so many unplanned pregnancies among young people. Unwanted pregnancies are resulting from things like vuzu parties, when someone doesn't even know who made her pregnant. So there's no one to take to court because they don't know. We then have unsafe abortions. This can be a whole day debate, but for us, we are saying with the TOP judgment that has been spoken about, I hope all those who are below 18 will have an opportunity to abort if they choose to do so. We are also talking about access in terms of user fees. And we always hear that our policy says there are no user fees for pregnancy, for maternal health issues. But we all know no free health is no health. So this is where we are. We also have had studies that have been done which show that 30% of adolescent girls were sexually active when this study was done, and the median age for sexual debut is 16 years. So the laws are now contradicting. We are now saying 18, that's when you start to have sex. But already at 16, at 14, children are having sex. What are we saying about this? For me, I always say, let's not really rely on the law for social issues, for behavioral issues. Because sometimes the law just gives us a framework in which to operate. I'll talk about the complications that may occur. We have heard about the obstetric fistula that can occur if someone gives birth when they are young and when they are far from the hospitals to get assistance. I'm informed that my time is up. For now, I had more to say, but I can say that later. Thank you.
Traditional leaders, salubonani. Mina ngizahlanganisa indima engizaziyo. Let's hope ukuthi along the way asoze ngishiye abanye abantu behind. My point of departure kuzakuba i-attendance yama-delegates that we have here. When I look at people around me and the people in this room, 3/4 of people that are here ngabantu abangomama. Nxa sikhuluma ngama-child marriages emakhaya, thina sivele emakhaya, let me emphasize that. Sivele emakhaya sikhangela abantu abasemakhaya. Abantu abasemakhaya is presumed ukuthi abafundanga. And as such, information ebuyayo is very limited. One of the lawyers lapha, she talked about umthetho owe-teenage pregnancy okuthiwa umntwana can now consent to sex at 18 years. Ngiyacabanga ukuthi emakhaya nxa ungahamba ethatha i-survey khathesi, probably will have half the people not knowing that the law has changed. Okay, now I talked about women being the majority in this room. When we are speaking about child pregnancies, the most influential people, when people are being forced to get married to when they are too young, are men. And obaba ngabantu abazinhloko zemuzi emakhaya. So I'm wondering, how is this information going to filter through to men who are the responsible authorities emakhaya? Because very few women are the authorities there. But having said that, I picked up there were some village health workers that are around here, which in any case, I should think amanyama platforms will be opened for them to engage abadala when we get home. And then child pregnancies, I heard some speakers saying maybe the chiefs again, they should be tried for authorizing child pregnancy, child marriages. I think if we open debate on this issue, we'll probably need 2 days. However, to be short and to the point, some marriages to young people, they happen without our knowledges in villages. I'll give you an example from where I'm coming from. Before the change of the age of majority to 18, there were, let me say this before that. I did a survey within my area because I realized there were some people, some children were not going to school at a very young age. And then I found out there were about 25 learners, children who were supposed to be going to school, but they were not going to school. Out of those 25 learners, 17 of them were girls, and the other half were boys. Which then maybe it answers the question of one of the speakers who said, why do we focus on girls? Because girls, they are the most affected. Okay, now, still on that, one of the 17 I'm talking about fell pregnant. And then when she fell pregnant, she was staying with the grandmother. I called the grandmother. I said she should bring the birth certificate for the child to find out why is the child not going to school. And we've heard the rumors, the child wasn't there. We've heard the rumors that the child is pregnant. The grandmother said, no, chief, lapha sesilungisile umntwana uyemendweni eviki ezayo. And then I said, no, awulungisanga lutho mama. Nthe mina answer the questions ukuthi why is umntwana engayi esikolweni? Wasithi umntwana she's pregnant. I said, ube pregnant, who made umntwana pregnant? But umntwana is one of the guys, we've got mining areas that side. Kulabo bantwana laba esibabiza ngochekecha. Yes, there is another name. Okwecha. So Okwecha lana was about 25 years of age. So what? No, sesihambile savela everything umntwana uyahamba the following week ngaphi. I went. And then I had to say to myself, with the panel that I had, because it was not a court, I just brought them in to try and find out why are the people who are supposed to be going to school are not going to school. And then we found out that the family that the child was coming from, it was actually being fed by this guy who was working by the mines. So now the reason why the child is getting married is not necessarily that the child fell pregnant. I think it is poverty. So the family were now relying on what? On this guy for them to survive. So now what I'm trying to bring to light here is the reasons why we've got some clandestine child marriages. There are so many, and we may not be able to deal with them or each one of them today. But however, as traditional leaders, we do not, or we are not called in when a child, or again, we are not called in by all the families. They do it their own way. We live in areas where we've got our culture. When I'm having my daughter about Kong Besiza, I don't call the whole village. I call only the closest relatives, and we deal with that. So in that case, some of these things, they slip through our fingers and we are not aware of them. But once we get aware of them, then we take action. However, this action, we do not take it in isolation. We take it with the local authorities that we have. That is the police and the courts. Because we always get guidance from the magistrates. This assumption that chiefs, or there's an assumption that chiefs, they know everything. But the truth is, the chiefs, they know next to nothing. The reason being, there is no topic that is discussed within our areas that don't involve chiefs. I think all of you have been talking about a lawyer here. We've been talking about a doctor at the other side. Those are professionals. But have you ever seen a professional certificate for a chief? There's no such certificate. So what we do is we cushion ourselves with the professionals around us. Those are the people that give us guidance. Right. To end this, now when it comes to the abantu they don't get uncedo nxa bebancinyane in case if sometimes when they are already pregnant abangamankazana. In most cases I think one of the statisticians who was here, she talked about the majority of people that are being affected, this being rural. And in that case, the reason enkulu ukuthi enza abantwana bengatholi lelo ncedo ukuthi abazali babo abafundanga. Now we're talking about, I gave you an example of this 15-year-old. She's 15 years old. She doesn't even know where to go and talk, or where to go to seek uncedo lokuthi she is pregnant. We talk about terms in pregnancy. I don't know which term and which term and which term. She doesn't even know anything about that. Now, because of education, it becomes difficult to abantwana bonke they get access to that facility. But however, I think programs like this, they help to enlighten us as chiefs together with our stakeholders so that in future we become more engaged with the people that we have in the community. Thank you.
Salwanani and good morning to you all. Sometimes before I speak, I usually encourage people to clap hands for me so that maybe if I don't say things that they don't like, they would have already clapped for me. So I think it's a good strategy. And also thank you, Chief Fuyan, for what you have said, and also the speakers that have said or contributed to the conversation. At times, I wish I can use my left and right hand. What I mean is to say, I wish I'm able to use Ndebele and Shona. So whenever I'm around the majority of Shona people, I use my right hand, which is Shona. And when I'm with Ndebele, I use my left hand, which is Ndebele. Unfortunately, I can't. So the topic that we are talking about here, the discussion that we are talking about here, is a critical discussion because it affects us now in the present and also affects us in the future. So I think this is critical, and we would like to thank the organizers who organized this platform because it's critical. And everyone who is here, so what I want to say, it comes from a cultural perspective, or the perspective that we have as a people about culture. And also I know I'm speaking to professionals, people who are well researched in this topic of gender and also access to reproductive health. We have lawyers, doctors, we have members of parliament, we have chairpersons of other committees which speak to these issues. So I'm coming from a not so informed perspective. But what I want to say is, what is our culture? I know we always speak about culture, and when we think about chiefs, we are thinking of people who represent our culture. And also when we think of culture, we are looking at this patriarchal society and the chiefs who enforce the patriarchal activities and also oppressing women and the girl child. I know this is the conception or that we have. So I want to address this misconception to say, what is our culture? Our culture is not chief. Our culture is not traditional leadership. Our culture is who we are as a people, as a society. So we cannot then begin to say culture is represented by a chief. Culture is represented by every one of us. Remember, we were speaking about issues to say, why is it we speak of reproductive health, ending child marriages, but when we go back to our areas, we find out that this continues to happen. Why is it? So like I'm saying, that our culture is who we are and is what we make of it. So what I'm trying to say, bear with me, what I'm trying to say is that the things that we talk about at Sapre Hotel and everywhere where we discuss these things should not only be accepted by the scholars in here, by the MPs in here, by the village health workers in here. But it can also be adopted as our culture. These things that we are talking about here can only be accepted if we put them under the banner of our culture. So how do we accept these things? Are the people accepting this end to child marriages? Are the people accepting all these things that we are discussing about here today? Are the people accepting the judgments that are made by the courts? Because I would want to say this, maybe making a reference and an example. The chiefs panels or the traditional leadership courts are not included in these things because a chief cannot trial a rape case. Why is that? We have an anomaly already, but chiefs are taken as courts. And also, sorry about time. I'm thinking now that there's the issue of time, but I will take the advantage of being a chief for a few minutes. Sorry to oppress you. We do not trial the issues of rape. Why is it? The members in parliament, the lobbyists, I know some of you are lobbying some bills and acts in parliament. They don't feel that the traditional leaders have the competency to deal with these issues. Already we have a challenge because the traditional leadership, we have 10 provinces in Zimbabwe which are represented by traditional leadership. So if we miss that gap, it simply means we are not able to tackle these issues because these issues are cultural embedded. They come from what we say, it's the cultural perspective, or it comes from the patriarchal culture that we did not come with as people or as the traditional leaders, but it came because of the colonial era. But what I wanted to say is that, you know, the traditional leaders use the jury system. I don't know if you guys have or know about the jury systems, but it's the system that is also used in America, is used in the UK, where they identify people from different areas, not because they know the law, not because they are doctors, but because of the principles and values of their community. And they make decisions based on the principles and values of their communities. And also, if you go to the traditional leaders, we don't make decisions solo, but we make decisions with the support and with the advice from the people from the community who represent the values and principles of that community. So what I want to say is that let's not miss that gap. 1 minute. Let's not miss that gap because it is a critical gap. But lastly, in closing and fast, because she waved a paper which is written something I can't read. I have an eyesight problem. So we need to address the root causes. The root causes are, the chief mentioned one of them. The child marriages are perpetuated because of poverty. What are we doing to address poverty? What are we doing to address employment? Because if our youth is not employed, and even if the Badara, the Chamberers, have nothing to do, an idle mind is said to be the devil's playground. When I'm not doing anything and I'm always sitting there by the backyard of my house, I'm seeing small ladies coming there, what comes to my mind? So an idle mind is a problem, or is the devil's playground. And as long as we have no employment in rural areas as well, as long as we are not addressing the issue of poverty, we are not doing anything to end these child marriages act. We are just singing and scraping the top of the surface. Because of you, I would like to thank you. You disturbed my conversation.
Pamusoro imadzimambo, pamusoro vana vari kukotsvera chirongwa, ndichataura zvishoma. Though ndasingauyi hangu zvanga ichitaurwa nevamwe macolleagues angu vaviri, but ndiri kufunga kuti vanga vachitaura zvandoda kutaura, saka I didn't want to repeat zvavataura. Denda ndawa kuti vanga vachitudi. But regai nditi ndatenda zvikuru kuti matidedza semadzimambo. Asi nhasi ndanyanya kufara because hamuna kuuya nevarungu. Saka tombobudirana pachena. Nokuti tisuwo kwedu. Tiri kuti isusu samambo. Pane zvimwe zvinhu zvisingagoni kurega zvichiitika. Zvinoti chivanhu chekwedu hachingazvitendi. Zvakafanana nekuti ngatibvumidzei kuti vanhu vangobviswa zvavo nhumbu kana vasachadzida, kana vakadzitora madiro futi tongozoti kana asachada futi ngaangoibisa. Ngatitarisewo kuti anobviswawo nhumbu, pamwe angave mwana abhinywa, amanikidzwa kuti abonde nezibaba, kauti nemurume, kauti nemukomana waasingadi. Kwete kuti vachidanana makore avo akatonaka vachibvumirwa kuroorana, then muongoti iwo handichakudi. Saka zvandisachakudaka handichadi mwana wako wasinyoro wako ndakutonobvisa. Otoenda kwadhokota unoti iraiti yangu kubviswa pamuviri. Isusu semadzimambo tinoti kubviswa kwenhumbu kuteurwa kweropa risina mhaka. Pamwe mwana iye anga achazove president, pamwe mwana iye wanga achazove minister, pamwe mwana iye wanga achazove mukuru wesvondo, mumwe wanga achazovewo mambo. Asi tongoti here ropa rideurwe nokuti munhu ane kodzero yake yokubvisa nhumbu. Saka ndiri kuti inini ngatibvisei nhumbu panenge pane a critical reason why that pregnancy must be terminated. Ndo input yangu samambo. Ndo zvitozoti kumwe kurashwa kweropa nekudeurwa kweropa kuchivanhu kwedu kunotadzisa mvura kunaya. Ichida kuti ndopa munozoti hey climate change momba mabhuruka muchienda kuAmerica kunostata climate change. Imuri makanga muchibvisa nhumbu sakanzi naMwari. Kokana vanayo vakanga vaita vana vari vaviri, Koloti akatoita vana nevana vake, nanhasi rudzi rwavo upenyu 1. Ndidzo nhumbu dzaifanira kubviswa idzo dzaLoti nevana vake. Idzi vamwe dzaita zvakanaka pasina manikidzo. Regai dzive shiri. Vana ivo vararama. Chimbomirai kundipikisa muna mbudzi futi. Ndiri kuti inini pamwe munotadza kundinzisa zvandiri kutaura. Ndiri kuti mwana, tine vana vanoda kubvisa nhumbu willy nilly. Ndo zvandiri kuti kwete hatingadaro. Ngatibvisei nhumbu kumwana abatwa zvataona kuti zvazvingaiti. Kwete kuti John naPeter, Jessica naPeter vadanana zvavo, vane makore avo anotenderwa. Then Jessica ongomuka akati iwewe Peter handichakudi. Saka mwana wako wandinaye ndakutonomubvisa. Ndo pandiri kuti kwete. Touya panhau yekuti zvozikanwa seiko nevanhu isu zvetiri kuno kuHarare. Ndipo paya pamochiuya kumushaka motaura nesu semadzimambo. Tounganidza vanakomana nevanasikana kuti vazive kuti murau unomboti kudii. Noti imwe nguva vana vaya vanotamba nazvo nokuda kuti havazivi kuti mitemo inoti chii, uye chivanhu chedu chinomboti chii, uye chirungu chedu chinomboti kudii. Saka ndichiti inini uyai tikubatsirei, musangane nayo mhuri yekwedu, musangane navo vana vekwedu. Pamwe nguva muchatona zvichisumudza maoko, pamwe nguva mukati anenge akabatwa ngapote nekuseruku. Muchaona tuchitoya twakawanda, tuchiti ndakabatwa, ukabatwa nani? Imwe nguva nokuda kwechivanhu chedu nokuda kweukama kwedu. Tisu madzimambo, tisu vana baba, tinoti haungaendesi sekuru kujeri. Pane makesi akawanda evana vakabatwa nehama are under the carpet right now. Tinavo vazukuru vouti unozoti nzwa sekuru vati uyu hanjezvi ndomuti muzukuru here kana ndomuti sekuru here, bhozi akaitwa naJohn namai ake. Saka handizivi kuti ndomuti munun'una here kana ndomuti mukoma. Kauti pakaitwa mwana wenhaka pekuti mwana wababa anonoroora mai mukadzi wababa wake. Saka mwana weya wakambozvarwa yena mai wake, kana vazovewo wakazvara yena mai nemukadzi wababa, haachazivi kuti omuti ani. Saka ndiri kuti uyai kumusha ndiko kune vanhu. titaure nevanhu vari affected. The society yekuharare haina kunyanya kuaffectwa sezvakaita yekumusha kwetinobva, nokuti vekuharare vanopota vachiverenga mapepa avo vachienda pamaindaneti avo. Kumusha tine kumwe kusingambosviki kana masaisai ekuti mwana angawanawo any information ingamubatsira. Saka ndaiti dai matsika nemakumbo enyu neorganization dzenyu tibatsirane kuti mwanasikana angapunyuka sei, mwanakomana angarega sei zvitadzo, baba vangarega sei kubata mwana wavo, muzukuru wavo, mbuya wavo vangarega sei kudzvanyawo chimwana pakati pezvita mazita enyu.
Maita henyu muri Thank you. My name is Concelia Mukarati. I am representing community health workers. I will express myself in Shona or show English. Chasanganisa. Toda kutenda varidzi vechirongwa vatikoka pano pane nyaya yakakosha zvakadai. Nyaya yedzimwe nyaya dziri kunyanya kushungurudza kunyanya kumaruwa kwatiri kubva. Nyaya yema-early marriages kumusha ndiri kuona kuti rate yacho yakwira kupfuura kuno kutaundi. Nyaya yema-early pregnancies yakakwira zvekare kumusha kupfuura kuno kutaundi. Saka rato dambudziko ratiwira mukati menyika, nekuti vana ivavo ndo vatungamiriri vedu vemangwana vari kukanganiswa upenyu hwavo. Ini ndakumbirwa kuti nditaure kuti zvinhu izvi chichiri kukonzeresa zvinhu izvi mumacommunities matigere. Magaps ari kuwanika ari kukonzeresa kuti zvinhu zvirambe zvichiitika ndeapi. Ndichangotsimbidzira zvimwe zvacho zvandakanyora zviri kukonzeresa zvaburitswa nana chief vedu pano. Kumusha uku nyaya number 1 nyaya iri kukonzeresa kuti vana vaite ma-early marriages inyaya yeurombo. Kumamisha kwedu kumazuva ano kunana gweja vataurwa nachief avo. Vari kunyanya kubata vana tuma-early marriages nema-early pregnancies atiri kusangana nawo mumavillages. Ari kukonzerwa nevana vari kuda mari kana kuti vana vari kubuda mumhuri ine poverty. Obva asangana nemunhu amuburitsira kana kuti $50. Mwana akutorarwa kwete kuti ari kuda, but ari kufunga nhamo iri kumashure kwake kuti inini ndiri kudawo kupfeka maskin jean zvikuita vamwe, but baba wangu havagone kundipa. Saka ari kuzopedzisira apinda murudo rusiri rudo chairwo chairwo. Mwana yeye achaita nhumbu. Aitiswa nhumbu nagweja. Gweja haasi kumuziva kuti anobva kupi. Gweja angomupa mari, varara vese, mwana abva atoita nhumbu. Gweja aenda kwekumutsvaga hakuzive nenyaya yekuti mwana wemwana mudiki. Saka tiri kusangana nemaproblems akadaro mucommunity. Mwana aita nhumbu, pamwe akutya zvekare kuti mubereki kumba kwacho hakusi kusvikika. Mwana anopedzisira asunga nhumbu iyeyo. Zvakukonzeresa zvekare kuti tichiita mwana tichimuita kuti aende kukliniki kuANC atinogona kutadza kuziva kuti mwana ane nhumbu. Ichisungwa atsvaga advice kune vamwewo vana vadiki. Vamwe vacho vari kupanana mazano ekuti itaini ndakambozviita kusandidzirana kwevo kuti anenge achingoti ngambozviono kana kuti ngambotiwo nemoto wakandipisa. Saka vari kutsvaga mazano kune vamwe vana vadiki ari kupedzisira vapinza muna taisireva. Osunga nhumbu iyeye kusvikira aide kuzvarwa. Mozotozongonzwa kunzi mwana wokwanhinga akazotsunungukira paseri. Ndine imwe kesi yemumwe mubereki akatoenda nemwana achifunga kuti mwana kurwara nemudumbu. Otosvika nesi vakutotarisa kuti mwana ari kuzonyongoka apa imimba inoda kutozvarwa. Amai havasi kutoziva, atotakura mwana achifunga kuti mudumbu memasi kana kuti chii. Nesi otozotarisa kuti iyi nhumbu amai chimbobudai. Kwakuzomubvunza, une nhumbu kaiwe? Ine mwedzi mingani? Yatokwana 9 months. Kwose usina kutaurira amai. Saka mwana iyeye taakutosangana nemwana 1 nhumbu iyoyo haina kumonitwa, number 2 mwana haana kubayiwa majekiseni anofanira kubayiwa paNC. Takusangana nemachallenges akasiyana siyana. Saka poverty ndo iri kunyanya kukonzeresa ma-early marriages kuma-communities kwedu. Then nyaya yekushaya ruzivo, tine echain yako kumamisha uku yekuti inini kana ndakaita early marriage ndobva ndafoswa kupinda mumarriage mwemene, ndobva tatozogara tatokura tatorarama tatoita mhuri dzedu. Mwana wangu akauya kwandiri achiti ane nhumbu aine 11 years, kwandiri ndinoona kunge zvinhu zvisina basa, zvinotoita kunge zvinhu zvinoma, nekuti handina ruzivo rwokuti zvakaipirei. Saka nyaya yekuti vanhu vari kumusha uku vari kufanira kuwana ruzivo rwakadzama, nekuti tinavo vakapinda muma-early marriages vatowana amai nana baba. Vanhu ivavo ndo vamwe vacho vari kukonzeresa kuti chain iyoyo irambe iripo. Then tiri kuda kutaura pane magaps zvekare. Ndotanga nenyaya ye-SRHR programs. Kwandinobva kune ma-programs iwaya, tine ma-implementing partners ari kuita ma-programs iwaya. But ma-programs aya haasi kubata vana vese, ari kuuya akafocusa on targeted groups like coaching boys into men. Iri kutargeta pamwe vana vari vakazvarwa nevanhu vari HIV positive. Sister to sister iri kutargeta vana, a certain group of vana, whereas tine vana vazhinji vamwe vacho vari kusiyiwa kunze nemaprograms aya. Saka tiri kuramba tine community isina ruzivo. Taikumbira kuti gap iro rikagona kufiliwa nema-SOS, kuti kana mauya kumusha uku mukauya neprogram yedzai kubata macorners. Tine program ye-sister to sister yakambotanga ichiitwa muzvikoro tichibata vana yatinoti catch them young iyai, but yakabva yazongobviswa nekukurumidza. Saka nezvi ma-early pregnancy atiri kusangana nawo community ari kuwanikwa kuvana vechikoro. Utonzwa kamwana kari grade 6 hanzi kane nhumbu, kamwana kari grade 5 kaita nhumbu, kamwana kari grade 7. Saka mukaunza maprogram iwaya twatangira pabasis apa kuprimary ikoko kuma-primary schools. Yes, kune ma-subjects ari kuitwa nema-teachers on SRHR, but vanhu vaivaya havasi kudzidzisa zvakadzika. I was a mentor we-sister to sister. Pandakaita kuchikoro ikoko ndatoona kuti pane very big gap. Na sister teacher wacho aidzidzisa akanga akutoda ruzivo from me. Saka zvikureva kuti pari kuda kuti pawedzerwe kana mukange mauya ikoko, if funding ikabvumidza, uyai mubate magroups ese kuti tigone kuikwipa vana ivava, tivape knowledge. Nevabereki vemumamisha ivava tivadzidzise. Ndanzi time yangu yakwana, ndandiri kuda kutaura zvekare papolicy yeabortion. Kuti policy yeabortion yakanaka, asi procedure dzacho dzakati rebei zvekuti tiri kuzoti mwana paanozosvika uku pamwe mwedzi yacho inenge isabvumidze termination. Saka tiri kukumbirawo zvekare kuti mutitarisisewo ipapo paprocedure yeabortion, kuti kana mwana akanzi ari kunobviswa nhumbu ngaangoti akabva apo oenda apa zvinhu zvobva zvaitwa maita imi.
Pamusoroi ini ndinonzi Erika Napi, village health worker zvakare. Ndapiwa kuti nditsanangure basa redu isu ratinoita munharaunda sema village health worker. Pandiri kuti isusu sema village health worker, mufaro wangu zvizhinji mukati mezuva ranhasi kuti takokwa neAmnesty International. Tiriko kuma villages ikoku kubasa redu hombe nderekupa health education kunyanya pa village level, tichizoendawo zvakare pa community level, uye kuraise ma-awareness campaigns. Zvakadaro tinenge tinazvo zvigozhero zvakati wandei zvekuti dzimwe nenguva shoko ndikaritaura nemuromo tine vasinganzwe, tine vasingaoni, vanenge vachido zvinhu zvakaita se-sign language. Ma-village health worker mazhinji vanonzwa, vanoona, but kune vamwe vari kusara kunze pandiri kuti zvakare tinoita madhirama mumaschools uye mumavillages kumukando zvakare tiri kupoterera tichitaura nhau iyo yema-early child marriages uye zvakare tichitaura nhau dzekuti isu sana amai kana nana baba ngativei nebandiko hombe rekudzidzisa chinhu chinonzi mwana, kudzidzisa girl child maringe nenhau yeabstinence kumirira nguva, nekuti vana vedu kazhinji kacho vari kumhanya, vachinge vamhanya vari kuita pamuviri, vaita pamuviri dzimwe nenguva inini amai handinawo ruzivo ndobva ndati ibva uende kwawapiwa nhumbu. Mwana ari kungopedzesera aenda mugrowth point ato sex worker, ava aita sex worker kudaro mwana iyeye ane dambudziko zvakanyanyisa rekuti ari sex worker kudaro ane nhumbu, apa nhumbu yaanayo iyoyo vanozvisunungutsa ivo vari vega. Tiri kutaura kuti by 2030 tinenge tane free generation, hazvisi kuzokwanisika nekuti mwana iyeye mumwe chete asunungukira mumba ANC anga asingaende, PNC zvakare haachavhizita zvakare, vakungoti regedza tizviite zvedu isu tega tiri pano. Saka ndiri kuti inini sana mbuya utano basa ratinaro iri tikashanda isu tiri hochekoche nemachifi edu nemasabhuku edu neutungamiri hwese hunongokwidza tichikwidza tichienda kumusoro, ndiri kuvimba kuti tinokwanisa kuenda ma-early marriages nema-child pregnancies for good, nenhau yekuti sabhuku akatanga kuti mwana achapiwa pamuviri ari kuno kuvillage, inini ndakuzobvisisa huku nekuti isu kumaruzevha tinonzi ukashanda nechisi zvakureva kuti unoendeswa kwasabhuku kana kuti kwamambo. Saka machifi edu masabhuku edu tikashanda tiri hochekoche nema-NGOs iwaya tichibatsirana kuti tikwanise kuenda for good, zvinotibatsiridza. Ndoenda zvakare basa redu tinyangwe tarifeya, tine chigozhero chakakurisisa chekuti tikarifeya vana kuenda kukliniki, dzimwe nenguva anonzi tuhospital, anzi tuhospital anenge asina kana transport kana chii chekuti azoenda kuhospital ikoko, zvobva zvaziva zvokuti zvakare mwana anozopedzesera aita se asunungukira mumba. Ndakukumbirisa zvakare kuti isusu tiri kumavillages ko tiri kubatsiredza vana vaye vasingaende kuchikoro, maschool dropouts, kuti maages avo ekunge achinge akwana ekuti vaone zvimainjection akaita seHPV tivarifeyawo zvakare vachienda kumaclinics ikoko. Takuchikumbirisawo kuti isu semavillage health worker nemachifi nemasabhuku tiwanewo ruzivo maringe nemapolicies eSRH akanzwa pano zvekuti kumaruzevha aiwa hatitozvizivi, dzinenge dzingori ngano nenhoroondo. Takungokumbirisawo kuti ma-implementing partners atinenge tinawo uyaiwo kugrassroots kutirira kuti tikwanise kupedza dambudziko ratasangana naro. Patiri kuvimba kuti aiwa imi nesu tose together we can.
We're having issues with our microphone. Yes. She was almost like a preacher, so the without a microphone or a bit.
Alright, thank you so much. My name is Kire Kademoga Shiva. So today I want to really share my experience of being a mother
And then I think I stigma already covered. Which is something I don't know how we can tackle that as a community when it comes to stigma. But I think my recommendation is maybe some people are never disabilities. But let's share about our stories. I always have many friends are not, why do you post everything on social media? I'm like, my reason is to share my experiences so that other girls out there, one know my experience, what did I from there, and could you go back and say that one never disabilities? And then another thing that I've realized, as long most women with disabilities, they lack empowerment and lack of resources. Currently, empowerment, lack of empowerment when it comes to knowledge, and lack of empowerment when it comes to money. Can also not marry on power and chokwadi. I realized that when I had my second baby, one day I age. Ndakango uza my husband kuti nini kana masina mari kuti ndiende private andisukuzozvara futi. Pandakaenda ku a private hospital, the treatment yandakawana from the day andakaenda kunyoresa kusvika musi ndakasununguka, I had information kuti nhumbu yangu zviri kufamba sei, stage and what should I do. Doctor akandiudza kuti haufaniri kufamba, you should rest well and all that, and for sure ndakatakura nhumbu yangu kusvika full term without any problem or any challenges. Another problem that I've realized in working with young girls and women with disabilities is, as women with disabilities, we atina most like power over our bodies or power over our SRHR, because we feel like the community or the society, not I don't know the right way to say, but I feel like our bodies no control one the society or one. I remember when I went in a room, I didn't find one was sure my comments akawanda. Then look a combo numbu yasinans getisi. And the very much one nature room up in the denga. And you see, but it's my right to put in this one. You see, it's my right to have that. And then one thing that I've also realized, I don't know what Tikabatrika will say, issue our society and also culture. In Otaragunzi, munhu zviitire mwana wako unozowana nokuchengeta mangwana, especially kwatiri vanhu vane disability. Kune mumwe mekuti maybe anenge angozvipira kuti iri yangu handiri kuita mwana, but unonzwa community kuzoti zviitire mwana wako unoona nokuchengeta mangwana, to the extent yekuti vamwe maparents vane madisability, they are going ahead vachinoronga kusaidi kurongera mwana wemurume kuti mwana we ave arare naye aite nhumbu kuti aitewo mwana wake azomuchengeta mangwana. And all these things they are doing it vasina kana knowledge yekuti mwana ine disability anokwanisa kuti akurere nhumbu yacho. Chii chichazoitika, they just go in blindly without knowledge yezvinhu zvese izvozvo. And then another point that I wanted to point out, the limited information and communication. I think mama vari pasaidi vatomboshara kuti ma community workers, ma nurse, most of them have enough information or knowledge on how to communicate with some people on disability, like vanhu vari deaf. Munhu ari deaf akapinda muya hana communication yaari kuita nanesi waari kuita, maybe ari kuda kana family planning chaiyo, but kuti anyatsotsanangurwa kunzi maoptions atinayo ndeaya, iyi yakanakirei, iyi yakashatirei, inoreva zvakati, vanopedzisira angoiswa kana jadheo kana angoiswa mapirizi of which maybe haasiri ari kuda, but just because haana information. Recently we had another workshop yataitaura futi nenyaya yeSRHR, and you'll find kuti vamwe vanhu vari deaf mibvunzo yavaibvunza unoshiya kuti this is just basic information yekuti I think almost everyone who has been using family planning information anofanira kunge achiziva, but you'll find kuti pane that breakdown iyoyo yekuti breakage yecommunication yekuti havana information yakanyatsa kuti zvavari kupiwa izvi majadheo zviri kumborevei, what does it mean and all that. And also iyo yekuti panoenda kana lese munhu ari deaf anoenda achida kunoona nesi kuti aiswe jadheo or anything, akasvika nesi havasi kukwanisa kucommunicata naye, which means now achafoswa kubva nasomeone kumba achazointerpret. Pamwe nini ndaendawo kuchipatara ndine STI handisida kuti zikanwe kumba uko kuti ndozvandiri, but nenyaya yekuti handisi kukwanisa kucommunicata nanesi uyu ndichatoenda nesomeone wekumba, pamwe ndiamai vangu vanokwanisa kunzwisana ndi pasign language, apa amai handisida kuti vazive zvinhu izvi. So I'm not sure kuti I think maybe pachatrainwa like all these healthcare workers, I think sign language should be a mandatory kuti vafana kunge vachigona basic sign language kuti vakwanise kucommunicata nema-customers nema-clients. I think I can go on and on, but because of time I'm just going to end here. Thank you.
Yeah, those are the lived realities that we heard from all our panelists. Rose, I'm not sure. Do we go to the next session or we allow for a bit of a discussion around this issue? Yeah, we allow for discussion because I really feel these are the real issues. Kubva kumadzimambo edu, kubva kuma CSOs, our community members, Nikiwe representing women living with disabilities as well.
Thank you so much. Sorry for being late. Daita funeral, but because I'm one of the champions, I said I have to go there 1.5 hours, then I leave. Thank you so much. My name is Susan Matsunga, one of the champions of Amnesty International, of Say What, everything you can name it. One of the champions of the safe abortion. Chamangwingwi. Thank you. Some they call me Honorable Machuma, but I don't call myself Honorable. Yes. Machuma is my totem. Pandomira nenya idzo dzimoyo wangu nenda kure. Thank you so much for giving me this opportunity, moderator. Let me say thank you so much for our panelists. I was very touched when everyone was contributing on the issue of SRHR. And I'm very glad to see one of my funny. I'm your follower, Sini. Since day one, even on the wedding. Yes, disability doesn't mean inability. Mango Jinzwira. But let's not take advantage of disability. I was happy that the chair of the Disability Caucus she's around. So my first issue, Mambo, ndovumirana nimi, zvamataura about hatisi kuramba kuti nyaya dzeabortion dzinge dzichiitwa. Asi panewo paakuitwa nanambuya Tumburai ofuchi zvakukwadza vana vedu. But ngationgororei futi kuti munharaunda matigere umu kune nyaya dziri kuitika under the carpet. You know, madzimai tiri varoi, vana baba tiri varoi. Tese, why am I saying this? Mambo kune nyaya dzinonyangadza. Regai mvura itadze kunaya. Murunzwa zvandiri kutaura. If we will not respect our culture, chokwadi until we understand kuti chinombonzi culture chi. Honorable the 7th day mwamusi vakamboita nini nharo avarapa vekadoma Honorable Mampipiri. Yeah, you talk about culture, you know that chivano ndikati chivano ndiwe because you are a human being. Yes, we need to respect our culture at the end of the day. Now yandaidza kuyataurira Honorable Mampipiri ndeyekuti ime hamungavati nemwana wasisi venyu. Handiti azviti mwana wacho unomuti ani. You know, it's difficult mambo zviri kurema. Then number 2, as policymakers, herobasa, we need to revisit my policies. Emitemo yakaitwa inisa ndaberekwa. Ndikatakura mimba ya Sekuru Mampipiri. Let me just give an example. He is my personal person. Ndaita mimba ya Sekuru Mampipiri. Iriku koti, but iriku tora nguva. You know, I was talking to someone here. A panelist achitaura, one of the panelists achitaura, you know what? It's dragging to an extent. Kuti ndoshika pakuzvara mwana wacho ka matondi kuvadza inini wacho. Ndakatakura numba. Mato kuvadza even ine mwana because the burden yandiri kufila inini it will connect nechinhu chiri umu. Number 2, early child marriages. You know what? Let's look broader picture inechekuita nechinhu chinonzi poverty. Muka inonzi poverty inorwadza. Yatuma vabereki vedu kuti vaende kunotirodza. Tiri vana vai vadiki nesu wacho tobuda tirichi. Toita say let's revisit the police because zvakafanana nema sex offenders, they are enjoying outside when they being given bail. Vari kudzoka mu community. You understand what I'm saying? Vari kupindwa iko bail ma sex offenders. Do we have the register? Do we have the data? Do we have the register of sex offenders? Do we have the data? Could this man she raped cousin yake kugokwe vatiza vaenda mukadoma vachinja sinemu akunzi matsunga abvaenda muharare akunzi tsetse. You understand? Tine ma-sex offenders ari kukuwadza upenyu hwevana mambo wokuti ari kubva kugokwe kusvika kumanikaland kuchimanimani achinja masenemu because we don't have the register yema-sex offenders. We don't have the law in very clear kuti whoever is a rapist webe kuti tidimbure mutara hatishande because tauraya munhu isusu tiri kuti isusu muchivanhu chena tisuda kuurayika isusu tiri kuti ingoti ngaore arimo kana achidya nyemba nebeans odya nyemba nebeans because you find kuti munhu akarepa kunoendwa kusaidi handiti kunotorwa mafingerprints but mukatarisa the very same person ndine issue. I think, thank you so much Aminist, makandipinza kundipa rimwe degree randiri kuita research ndega. I was doing a research ndichitarisa zvangu kuti kuna marepist akaenda kunana England vakanorepa vari muno vemuno muZimbabwe vakadzorwa but vakabuda paairport. Vabuda paairport hakuna kana kurezwa alarm kana kuziva kuti munhu akutoenda unorepa futi. You get it? Vari kurepa vana vedu. Then let's go back to the culture. Let's go back nekunzwisana tudzane chokwadi pano kuti mimba yebhinya haichengetwi. Mambo nyangu akasava sekuru wangu but handigone kuchengeta mimba yebhinya. Mimba iyoyo when we are going through near the SRHR, maternal mortality, near the disability. Because Muno Mutinangani, disability. No, everyone. But physically, what you know, 1, 2. 1, 2. 4 only out of how many? I need to challenge you, Aminist. Leave no one behind here. Let's leave no one behind. Yes. Kuna chima chiri kuitika now the SRHR. Kuna a community LGBTI plus Q people. And let's not run away from this thing. Yes. Because LGBTI. Yes. We want to talk about SRHR. Yes. Let's talk reality as it is. Yeah. It starts on the top. Kushikabai. So the moment they feel that we are not going anywhere. Then number 3, still combating children and fistula. They was there Maxine Robert take a share. It becomes the one editorial managers. But when I want to see what I want to my provinces. Here we are as honorable members. My plea to you, each and every member, you are a champion. Yes. Yes, things have changed. I was still we are not my community change. You want anything? Tinabasa, because the moment that you put it 2030 to find out that achieve something, we are not going to achieve anyone as long as we are not holding hands. Yes. We are not holding hands with others. Yeah. Let's love one another. Let's go for each other. And let's go back home to the constitution and the mitema you could have gone and Juba. Because I'm not able to order more than 72 hours in snow is for me. Yes. Yes, it's not in a bitterness.
Thank you, Honorable. Thank you. Thank you, Honorable. Yes, uko Mongo try kutaura ne voice iri patop. microphone hatisipita ngatiteererei. Which
you might not do it. In as a person, I cannot get an abortion. But if someone wants an abortion, where am I to judge? We live in a society where single mothers are judged in and out. Because there's an irresponsible absent father behind. Mukazi ndiye anotakura ma-consequences. Ndiye the present parent, but still ndiye anenge achingonzi ari wrong because ari kutakura evidence yekuzvara. You tell your children kuti wewe usatiri munhu awarora mupfana. Every single mother anoitwa kunge hure because vane evidence iyoyo. We want people to decide for themselves. Kuti inini no, I cannot give this child mwana life yakanaka, so it's better to be rid of it. Inini andikwanise kuprovide ABCD. Munhu anoziva situation yake, munhu anoziva life yake, munhu ngapiwe right yekuita decision iyoyo, oregedza ega pachake. Yes, give counseling. Muudze kuti zvakaipirei zvakanakirei. Asi at the end of the day kana aita decision, ma options iwo ngave available and accessible. Munhu ada abortion, yes it's wrong, but is it by pregnancy? No. Kana zviri zvaari kuda, it's her life. Chichakanakira abortion, chichakaipira abortion, topa munhu ma options iwayo. You would see kuti munhu anopedzisira achinja pfungwa, unomuudza kuti no, enda kuorganization yakati unobatsirwa. Unokwanisa kuadopta mwana, unokwanisa kuti mwana adoptwe, then wozoita sei, wozonomutora, unopa munhu ma options. At the end of the day, achazochuza kuti no. And I know as a woman kuti some decisions vanhu vanenge vasina ma options, vanhu vatotaura navo vatinonzwa, we know kuti munhu kwakutopererwa. And I think tofana kuva open minded kana chitaura nyaya idzidzi, because already kana takutojaja atichape ma options ekuti pamwe waite sei vave open.
All right, let's try and be very brief, 30 seconds each, so that we all get the platform to say something.
Okay, I just want to thank all the panelists, but I think this is to Amnesty and the organizers. I think it was also going to be fair if we had someone who was representing the religious side of it, because we are saying kuti kumachechi kwatinoenda ndokumwe kune imwe nyaya, like what she was saying, kuti we confide in vanhu vatinoti very close to us, official very close to us, vazhinji vacho tikada kutarisa us as young women, ndana mai vedu vanoenda kuchechi. Saka ukangotanga kutotaura nyaya vakutotanga kutodzoti kuchechi kwangu ini ndiri mai vebhachi, ndiri mai vachakati, vakazoziva kuti iwe mwana wangu udaita zvekubvisa nhumbu, yatova imwe nyaya. So if you had maybe the religious part of it, vachitiudzawo kuti what does the church say about nyaya dzeabortion, even nyaya dzemachild marriages, because even kune mamwe machechi that we know tese tiri munomu ndokufuti kune dzimwe nyaya dzevana vari kuroorwa vari vadiki. So it's a challenge or just a comment for future programming. Thank you.
Thank you very much. There's a hand.
Hello,
there.
everyone.
I'll take 1, 2, 3. Yo. Okay, let's do 30 seconds. 30 seconds. I'm seeing so many hands, so that each person and one a contribution.
All right. So, Mina, I'm going to speak on behalf of Ama 2K. Because ndikenda abantu besithi kati Ama 2K, why are you not participating? So one, Tina is the young people. I don't really want to defend ourselves in this. We are also wrong. Because not we are ignorant. Like we get these notifications, which come for these community what, come say out what you want, and see just say these things into Zabadala, we don't come, we don't show up. But at the end of the day, when a decision is made, we are the first ones to complain. Two, amanye ama-chief na abanye abantu abadala, like ama-religious leaders, they are also involved with underages. So how do they say something when they are also part of it? So that's why they are not able to say anything in their defense, because now they are involved. And you are being promised the to and from the moon. Now I look at the advantages and the disadvantages in it. Why not risk it? Sesingen. Thank you.
Thank you very much.
Thank you very much. I've just got two issues. Something to follow up on this 2K. There was a time when we received a petition from ACT on removing the restriction for the adolescent to access SRH services. We went on public hearings. The chiefs, not the chiefs, the religious leaders mobilized for us and the media to make sure that we fail. Yes, we failed. But in Bindura, the young girls in Bindura took the religious leaders home. Because when the religious leaders were debating against Nyaya, you know what the youth said? Anzi mimi wafundisi nyararai, because usiku tinorara nemi, makuseni mnoenda kunotiparidza. Muri vanhu chirudzi. It's the same story. Right now, ngicela ku explain abakithi izinduna zami. There is umthetho already which says age of majority is 18, true or false? Age of consent to sex is what? 18. There is no access yet. Umntwana omita below 18 licala. So why isisu esecala sisalela ukukhitshwa? Yena umntwana lo masefuna sikhitshwe. This is the law these people want. And we mustn't have a panel that sits to condemn that law or that success. Because we can, the minute we lose at the Supreme Court now, we are finished. We will never succeed. Yes. So MPs, sungai mabandi in parliament. Because ndato read hapa. Kuti opposition ya mchaona in parliament, amsati mambo iwona. Lawa wena mama we waki, kichimani gates and train MPs. Train people, train communities, bafundis. Even ilina ma chiefs. Uguti, yes, it sounds like it's not normal, but we have said umfazi angabanjwa inkunzi ngumkakhe. Liyangizwa? Umfazi angabanjwa inkunzi zinduna ngikhuluma lani licala anti. So isusu esingene ngecala sifanele senzeni sichaye phansi. Ngiyabonga.
Thank you very much. There is Tendai there.
So thank you everyone. Inene issue yangu nduda ku relate kune my health workers kune vataura zve maternal health. Ya muri kuita zvakanaka pamuri kutaura nyaya kuti kune vanenge vabhinywa kana vaita sei they need to abort. But inene issue yangu iri panyaya ye inclusivity. Are you being inclusive? Nekuti pane nyaya yataurwa nasisi vangu chokwadi zvekuti vanhu vane ma disabilities vanombunyikidzwa vari kudzimba vari kwavari voita nhumbu asi havasi kuzowana education iyoyo. Pamuri kuita maprograms enyu munogona kuita kwamuri kuita but hamusi kuva include. Tiri kuti include vanhu vane madisabilities. Also itai maprograms enyu mumaschools. Pamuri kuita pacho it's rather better mutsvage kana vanhu vane madisabilities vari mumaorganization even vasiri moshanda navo so that pamunotaura zvinonzwikwa, nekuti chikataurwa nemunhu ari machiri chinonzwisisika more kudarika kuudzwa nemunhu asiri. Zvakafanira kuti kuudzwa kunzi chironda chinorwadza kana wakuwara nemunhu asina chironda hazvinzwisisike, asi nemunhu anenge akakuwara unokwanisa kunzwisisa kuti zveshuwa uyu munhu uyu akarwadziwa. Saka shandai nevanhu vane madisabilities pamuri kuita maprograms and also pamalaws anenge aripo pamitemo yese kuti vanhu vazive. Itai kuti ive accessible to everyone. Kana iri for munhu ane visual impaired, make sure kuti zvinhu izvozvo zviri kuverengwa nevamwe zviri in braille. Kana vari ve sign language zviri muway yavanonzwisisawo.
Thank you very much. I'm seeing so many hands and I'm left with 3 minutes only.
Okay, thank you so much. My name is Tendai Westerhoff from the Pan-African Positive Women's Coalition in Zimbabwe, which is a national network of women living with HIV. I would like to thank all the panelists, but my concern is we were also expecting to see a woman living with HIV working with the community on the panel, because all that it's centering around women living with HIV. The discrimination starts here. Yes, we are here, it's good, but that's where the discrimination starts, and it goes through the structure up to the community, the leaving no one behind. We are turning it around to leave others behind on critical matters of mortality rates, of sexual and reproductive health. The HIV pandemic in Zimbabwe, it's still feminized. Statistics, not only in Zimbabwe, even when we come from the community, it's 60% are women living with HIV compared to 40%. Women have a health-seeking behavior than men. Women living with HIV still have unmet family planning needs. They are facing stigma and discrimination in the community because of certain harmful cultural and religious practices that are there. If a woman is told not to breastfeed, when she goes home, she's prone to gender-based violence. And if a woman is known to be living openly with HIV like me, there's so much stigma and discrimination. For me, people may think I don't experience it, but I do every day. But because I'm just used to it now, people think I don't see it, I don't experience it. So in future, when we talk about subjects like this, we cannot leave women living with HIV on the panel. You are discussing our issues. We are here, we are doing the work, we have structures nationwide. And when it comes to platform, we get left out. But anyway, we are so happy, we had, and the problems are the same. Thank you, Sinikiwa. I'm so happy that I've met you today. I hope I will have a picture with you. The stigma that we experience, we also experience it as women living with HIV. We experience the double stigma, you know, of living with HIV, divorces, the blame, and everything, the isolation, we also experience it. So we just hope that in future, this discussion will carry it over, and the learning lessons, we are also going to implement them in our organizational plans, so that we see what we can also do. But in future, let's have inclusivity.
Thank you.
Where there are issues of women living with HIV, put us on the panel. Thank you.
Thank you very much. Thank you. Thank you. Thank you, Tendai. I want those who haven't spoken. 1, 2, 3, 4. 30 seconds, 30 seconds, 30 seconds. And we are done.
Thank you, everyone. My name is Nyasha Mdavano. I'm coming from Population Safe Zimbabwe. I'm the Advocacy and Gender Advisor. Thank you for the panel for lived experiences, for what you're doing. One thing that I've heard from this conversation was the unmet need for family planning in Zimbabwe. Yes, the unmet need is still is right now at 88% in Zimbabwe. We are doing all we can to make sure that every woman in the marginalized community have access. But this year, we had our agenda analysis for sexual reproductive health service. From the results, what came out was that the social, the cultural norms, they are still major barriers in terms of accessing reproductive health services, including family planning. One example was an experience of a woman who came to our outreach team with a jadel, and she was in need of a jadel removal. She was probed, why do you want to remove this? She said, I'm in a polygamous marriage, I'm the third wife. For the past 5 months, my husband hasn't come to my bedroom. And he said, until you remove that thing, then I'll come to your bedroom. So you find that because she's in a polygamous marriage, one. Secondly, because she wants to be intimate with the husband and being denied because of having a family planning method, she had to come to us for a removal. We had to remove because we don't force anyone. You come, we remove whenever you want to remove. But those are some of the issues which women up to date are still facing. I would also like to respond to disability-friendly services.
One of the things that we have tried to work with the ministry is for example, making sure that our services are accessible to people living with disabilities. We have printed a lot of braille materials with information on family planning, but the challenge is there are rooms within the ministry, there are rooms even at our place still filled with those materials. Why? The reason is on the end, who is going to use the braille? You print a braille for someone who is blind and they have not been trained in terms of using it. So you find that the uptake and the usage of such services are limited. If the ministry maybe can fast track or even push for effective training, not only on health service providers, but even on community champions who can speak or who can utilize these disability-friendly materials that we are going to print.
Thank you. We need to give others an opportunity. No, you have done two. Let's hear from others. I'm looking at time. We'll come back to you maybe after lunch break. Yes. Kenya.
Zita rangu ndinonzi Ekenia Chifamba, ndiri shamwari yevanasikana. And thank you, Tendai, for correctly putting it across. You said your side of the story. And I was going to ask Kuti, vasikana vatiri kutaura nezvavo, where are they? Because there is a popular mantra in the social media. So there's a popular mantra mazano kind of social media. They are saying, we listen, but we don't judge. We have been doing quite a number of initiatives. I can see our partners who are here, Satwag, and I say what, and the others. Conversations, yes, with the chiefs we have done with the religious leaders. But Kumadandaro, we are conversing with the girls themselves. You'll be surprised by the issues that they're bringing on the table about SRHR, and as they talk about safe abortion. Takaenda kwachiwota. Isusu kutaura kuti zvoni, it's the ladies vemarine who are taking up the role yekubvisa vana pamuviri. Are you aware kuti vana vacho pachavo, because they're saying we listen but we don't judge, they are finding solace amongst themselves. Vari kutozivana pachavo kuti mukatoenda kuna Ekenya anogona kutokubatsirai kubvisa nhumbu. And these are kids who are below the ages of 18. So we need to bring the girls to the table. We were supposed to see the girls there. We hear their stories from them. Because then we end up making decisions on behalf of the girls. So next time, their side of their story.
Thank you. Thank you. Really, we need to leave no one behind. That's the last contribution there.
Thank you so much. I am Chaka Ruzidzo, Men for Equality. We work with men. Ndo maperpetrator, ndo vari kupa vana dzimimba idzi, ndo vari kuviolata vanasikana ava. Saka isusu tikutaura a three-pronged approach. Number one, we need to engage men as partners. Panyaya yataurwa naSnikiwe yandabatikana, paataura paavhunzwa kunzi aripi partner. It's also very important that we learn kuti partners, male partners should be there supporting their partners kana paine wirirano. Pakakosha ipapo. Number two, men as clients. Ngavazive kuti kana pane pamuviri ndepedu tese, hapasi pemudzimai oga, tese tinenge tiripo, we are all clients. Number three, men as champions. Tikuda varume vanotaura kuti isusu munzvimbo medu hatidi, hatisi kuda vari popular only. We also need to work with that ordinary men. Teacher wewe anokwanisa kunge achidzidzisa vana vake, that men anoshanda pamusika anodeedzera kuti pano pamusika it's a safe space for women. Tiri kuda those men as champions who also champion the causes for women and girls. Thank you.
Thank you very much. I was hoping we are going to have 30 seconds each from our panelists as we wrap up, but I think let's pack that, and then when we are now doing our recommendations, all these questions that came up, we will discuss those. So let me take this opportunity to thank our panelists for that very fulfilling discussion.